Hello, this is Dr. Dheeraj Masapudheeraj. I'm a senior consultant in the field of neuroanesthesiology, and today I'm going to cover a very controversial subject, that is why Indian doctors work more than other country doctors. So, because what I observed is doctors in countries like UK and Japan and other developed nations, they're working 5 days in a week, and also they will have a day of work, they dedicated for research and academic activities in a month. 1 or 2 days will be there, but in India we work for 6 days in a week, and also we work on holidays if required. So why is this difference there in India and other countries? I'm going to explain why are we working more. So if you are thinking that I'm telling you to work less, then you are mistaken. Okay, I never recommend that to anyone. Okay, but what I'm trying to tell is the essence of that. In the end of the video you'll understand, so you have to watch till the end. If you watch only to the middle, you will think that I'm telling you not to work. Okay, so let me show you the differences between. So the differences in healthcare systems, if you see Indian healthcare system, see the main difference I'm trying to compare between UK and Japan, and see the main difference comes between the doctor-patient ratio, and also what kind of governing body is there for healthcare. For example, in India, this 2020 stats, in India, one doctor is there for 1600 people, but in 2024 it is around 800 to 900 people. But in UK and Japan, there is one doctor for 400 in 2020 only. So now it would be around one doctor for every 300 patients. And in Japan, one doctor is there for 308. Maybe now 250 to 260 people would be having one doctor. So this is one of the main factor which decides how much work a doctor should be doing. So because if one doctor is serving 1000 people and one doctor is serving for 250 people, obviously the country where you are staying, where one doctor is serving for 1000 people, should be working more, right? So that is the basic common sense point. So that is why to deal the volume and load, we would be working more in the country where patient doctor ratio is more. Okay, so that is one of the main reasons. Okay, and the next is the population. The population is significantly different between India and other countries. If you compare, Indian population is 1.4 billion and UK's population is 67 million. Okay, and then Japan's population is 128 million, slightly more than UK population. You can see we are dealing with a very big number of patients actually in India. Okay, once everyone starts getting insurances, once everyone starts getting these Ayushman Bharat schemes and everything, then our doctor number will not be able to actually cater to the population. Okay, now because many people are not having money, maybe they must be not reaching the hospitals. And also what I observed is the cultural attitude towards the work is slightly different in India and Japan. And see the working hours, if you see in Japan, it is like 40 to 60 hours, and on average 50 hours is the working duration. And in UK, 48 hours is the maximum allowed duration in a week for doctors. The labor laws are very strict there. But in India, there is no such, maybe a rule is there. I've seen one of the AIMS, circular where they said that around 48 to 50 hours is the recommended time. But I'm telling you, practically in India, nobody follows that. In India, 70 hours, 100 hours, how much ever you put in a week, no labor laws are going to act against that particular organization, mainly because nobody is really keeping account on how many hours you are working here, and nobody is really bothered. And then hard work, in Indian culture, hard work is appreciated. So what happened is more than innovation, more than research, hard work has been appreciated in India from generations. The reason is that our ancestral doctors were working hard to clear the number of patients, because they had their less in number and more patients they had to deal. But now that is not the thing. In the end of the video I'll tell. Now the system is changing. Even in India the production has increased. Okay, so since they worked very hard, they actually appreciated the students who are working very hard like them, and they promoted them, they respected them. In the way, the hard work has imbibed in our culture, and everyone tries to work hard. So here we feel proud saying that we work for 6 days in a week, 7 days in a week, or working 12 hours in a day. So that is in our culture, and innovation is not taught in our culture. Research is not taught to our cultural in the teaching program, other than central institutes. I am not saying any institutes here and there. Some centers would be doing, but no major research is being happening anywhere, because that is not actually taught in our this thing. So this is another area that we need to change. Actually, from hard working nature, we need to shift over to moderate working with research and innovation. That will become a very good blend for your personal career and CV, and also for the country. The labor laws and regulations in UK, Japan and other countries are very strict. In UK, they wouldn't allow any person to work more than 8 hours. If he works, then 11 hours of rest is required between the shifts. In Japan, 8 hours is the maximum allowed duration, and 10 hours of rest is required between the shifts. But in India, you work for 12 hours, 24 hours, any shift, 6 days, nobody is really bothered. The labor laws and regulations, I don't know who is keeping check of all these things. So medical education and training. So basically the medical education and training in developed countries in UK and Japan, the emphasis is more on the quality of care because they deal less number of patients. Patients' experience is what they're focused on. But in India, unfortunately, since we deal more number of patients, our focus is more on the quantity. And because our ancestral doctors, one doctor had to see 50 patients, 100 patients. One anesthesiologist had to give 7 to 8 cases in a day. But now things are changing. We don't really have to do that now. We can focus more on the quality of care now. So the numbers will tell the story. The doctor patient. So Indian patients per doctor in India 4.1 times higher than UK, 5.5 times higher than Japan. The population size is 21 times more than UK and 11 times more than Japan. And Indian doctors work 55% more than hours of UK doctors and 40% more hours than Japanese doctors. So we are doing that because of the reasons which I mentioned till now. Now I'll tell you how to overcome this challenge. Number one way is that by labor laws becoming strict. Because in individual level, if you try to rebel against the organization, you will become a black sheep and you will be targeted, which I don't really want. If you are my subscriber and following me in my channel, then you have to excel in your career. So it should come from the labor laws and regulations, and they should make changes in the hospital. Individual level, you shouldn't rebel according to me. You have to follow the rules and regulations of what your hospital is being followed. In medical education level, they have to change. They have to focus more on the development, emphasizing the work-life balance and well-being and skills and health, and all these things should be emphasized from the education level only. Okay, and more resources need to be given into the public health system, and doctor-patient ratios need to be reversed, which is happening now. We're producing around 1 lakh doctors in MBBS, and 50 to 60,000 PGs are also coming out. So you will have a decreased doctor-patient ratio in future. So, and then the next thing that would be a balanced healthcare, which means you have to empower the doctors to have a quality care than a quantity care. That is what you need to teach the doctors, and also give them best equipment possible. Okay, and then so that they will give the quality care, and quality nursing care also should be there. So this is how you achieve a very good balance. Okay, and then and this achieving good balance in healthcare will be possible in future because Indian healthcare is gaining international attention now. So significant international funding is coming. I have shown in my videos on how much funding is being done in the hospitals of India. So when the funding is happening, they can appoint more doctors, best equipment can be given, and best there can be a good quality care which can be given to patients. At the same time, doctors can also have adequate rest and maintain their health and work-life balance. So this is going to happen in India in future, and so this will improve the skills of the doctors in giving a good care to the patients. And the exploitation, I don't call exploitation, but what will happen is, since everybody is working hard, nobody will realize that you are being exploited, because every doctor will be working 6 days in a week and 7 days in a week some places, and so this long hours of working and inadequate compensation, lack of work-life balance will lead to burnout in the longer run. So this needs to be addressed as soon as possible. And so after looking at this video, the hospital owners must be thinking that, so if we appoint more doctors, then our revenues and profit margins will come down. That is a myth, because according to me, what will happen is, if you appoint more doctors in each area, what will happen is you will actually have an opposite effect. What you will see is the quality of care will improve, patient experience will improve, these patients will get more patients to you, and they will be dealt better. So what happens is, overall in a longer run, if you see, the hospital will become more famous, and hospitals revenue will increase and profits will increase. So this is what a message hospital administrators should take from this video. And then you can develop a culture of innovation. Okay, so what happens is the revenues can be improved with innovation patents also. So hospitals can develop research wings which normal hospitals don't have. You can develop research wings, you can develop innovative areas, you can develop collaborations with many companies and develop a research verticals, involve doctors in that, because they are the ones who are going to tell where problems are in the healthcare. In the process, you will actually develop the hospital revenue and also develop the innovation and profile of the doctor. So this is how a bigger hospital needs to think. Okay. And prioritizing patient experience. So basically, if you have a good quality research in a particular center, good quality equipment, and more number of doctors who are dedicated in improving patient experience with the gadgets that they have, and that is the place where patients will have the best satisfaction scores and patient experience, and they go to their homes and they get more patients to that particular hospital. This is how it will work out. So everything is synergistic and they work in sync. So this is how bigger hospital needs to plan its workforce and revenue growth for longer term. If you are looking at 1-2 years, you cannot do this. If you are looking at a 10-year horizon, then this is the way to plan your hospital. Thank you very much. So if you ask me as a doctor who is watching my video, and most of the doctors only watch, I know, you need to have a kind of a balance in your work. You can't keep working all the day. You need to balance it out. Work on patient care for some time, work on research for some time, work on innovation for some time, and in that way you build your CV better. Most of my audience are interested in going abroad, I can understand. So many people will be messaging me how to go to Australia, Middle East. So first, before deciding which country to go, build your CV. Build your CV not only with your logbook but also with your publications, with your audits, with your social service activities that you can do, and any fitness goals if you have, you can put that also in your CV, and you can holistically innovations that you're planning to do in your future, you can put in your CV, or any technological advancements you want to get into your healthcare, like AI in head injury and stroke, AI in liver diseases, AI in this. So all those things, if you want to really work, you have to cater some time to that along with your work. So that is how you need to plan your future. So this will be possible only when you have enough number of doctors working with you. And India, fortunately, the number of doctors, the MCI is increasing. That is good for us. We can plan our balanced life and also plan our careers better with this. So don't think that your salaries might come down. If you actually work in the way which I told, you build your department size and work on all these things, and you actually make more money, more salaries than you get now, okay, by slogging day in and day out. Okay, think smart, and you will understand what I told. Thank you very much for